Thank you for watching SHEM Ministries. Souls honoring Elohim's mandate. And now for today's message.
Father, I need you. I can't live without you. Father, I need you always. Father, I need you. I can't do life without you. Father, I need you always. Glory be to God. Father, I need you. Speak into the Lord thy God, the ruler of all things, the creator of the heaven and the earth. Lord, 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 I cannot live without you. And I cannot from day to day, my God, do this life on earth without you. Glory be to God. Well, welcome to SHEM Ministries. I'm sure that's not how you anticipated the broadcast on tonight to be, but I need to let you know and remind you that this is God's service. We are only under subjection to the Holy Spirit. We, Pastor Devlin and I, in this ministry, do not anticipate a certain order of service. The only thing that I would hope you would anticipate is that he and I will give God the praise, the honor, and the glory that belongs to him. We will recognize him. We will acknowledge him, and we ask him for guidance. So yes, this is SHEM Ministries. This is Souls Honoring Elohim's Mandate. And tonight we are off schedule because normally we broadcast on Tuesday nights, but God had another plan. And sometimes our plan, what we are used to, sometimes, let me just be transparent with you. At first, when I found out that I had to work last night on my normal Tuesday night that I broadcast, I got a little annoyed because I don't remember anyone asking me to change my schedule. But guess what? I remember many years ago, the Lord told me, I make your schedule. Because I used to get upset when I had to work in a certain area and I really didn't want to work then. But something would always happen that let me know that I was needed at the time that I didn't think I was needed. So to God be the glory. Working last night was a blessing for me. And so we give God thanks and praise. So tonight, this is our SHEM 2 night. It is a spiritual, healthy, enlightening mandate ministry. And that is just what it is. And I decided today, I said, Lord, I am going to renew my vow, my dedication to serving you every day by singing that one verse in that song. So when I say When you tell God that you need him, I mean, you really need him. You're not saying it just because, but I need you. And he knows I mean that thing. And I'm letting him know that I can't live without him. How much more renewing of your vow to him do you need to say, to declare? We declare our love for each other. We declare we this, we that, but why not make that declaration to God every day? So that's just something that I'm just, adding to my little daily ritual. So we give him praise. We thank you for each and every viewer, those that maybe this is your first time viewing this ministry, but and I say welcome, welcome, welcome. I do ask that the Lord will assist me. I can't do it alone. Crucify my flesh and let the Spirit of God speak to you on tonight. We are on our third part of our series, Well Informed, Making the Right Decisions. And I am Dr. Anna Shaw Devlin. I am a family nurse practitioner. I've been a healthcare provider for 35 years. And I've been a nurse practitioner for 20 years. And I've seen a lot of stuff. And so my goal, the premise of my ministry is to share things with you so that you will be well informed. Yes. But right now, the well informed that we're speaking about is making medical decisions. We are asked every day to make decisions about our health. And that soap opera, One Life to Live, well, guess what? You only have one life to live. And there are some things that we do that cannot be undone. There are things, unless the Lord heals us, okay? But many times we are left with residual damage to our temple that gets broken down, and some of it can be repaired, and we're going to talk about quality of life in the decision-making process. So we've already prayed, and I'm asking God to just bless the words that come out of my mouth, that they will edify you where you are, where you may be in your life right now. Whatever is said, you take it and make it applicable to you, your family, to the stranger that you may meet next week. And they may say something crazy out the blue, and you're like, oh, now I understand why it was meant for me to tune in, even if it's only for 20 minutes, okay? But get what you need to get. If there's a drawing, don't turn a channel, don't flip, listen. Please listen. So we talked, we did part 1 and we did part 2 of being well informed and making the right decisions. And we talked about advanced directives. I want to just start out really, really quick by just telling you quickly about advanced directives, okay? And you can go back and review the last 2 lectures. But I talked about so an advanced directive is basically, this is an umbrella, right? And it's just you telling people in advance directions for things that you want in your life. If you are ever in a situation where you cannot make decisions for yourself, okay? And do not assume that you have to be at the latter years of your life to not be in a situation to make decisions. You could have an acute allergic reaction. You can't talk. You're on a ventilator, even though it's short term. And until you are healed to the point where you can, they can restore you to your norm or whatever, you may not be able to say things for yourself. So making it known and letting people know, these are my wishes, these are my desires, this, that, and the other. This is for everybody, all of us. And that includes having the healthcare power of attorney, having the living will, do not resuscitate orders, and also our decision for donor registration. And so I'm not going to go into any details about that, other than I do want to quickly emphasize that I'm going to show you this right here. There are many types of advance directives. And like I said, the DNR and all of that come underneath that umbrella. I do need you to understand that the advance directive is a legal document that you yourself, see where it says it's created by the individual? You do that. You do that. Every adult should have one. And it goes through and says, these are the end of life treatments that you wish for, okay? And you actually can designate a healthcare surrogate in your advance directive that you name someone and say, well, if I can't make decisions for myself, this is my healthcare surrogate. Then you also can have like a healthcare, like an emergency contact number 1, number 2, number 3, if necessary, if that person is not available. I have encountered some patients who that person died and they never updated their stuff, right? And so you have a list of who does what in their stead, okay? So this is something that you do, and this is something that very simple. You do it, you fill it out, and you have it notarized, and you give it to your doctor. You can give it to all your loved ones. Put it in your safe for safekeeping. At least it is a starting point for your family. Even if you do not go any farther than that, at least start there. Okay. And I did want to remind you that emergency medical services, EMS, 911, if something happened to you, your advance directive does not give them the permission to withhold life-sustaining measures. They have to initiate CPR, this, that, and the other, and get you stabilized. Then when you get stabilized and get to the hospital setting, the other, stuff can kick in. Do you understand? Unless you have a DNR. If you have a DNR and it is present at the time that emergency medical services comes to the rescue and they have this form, this is what it looks like in North Carolina. It's the yellow form with the stop sign. It says, do not resuscitate me. And these are the details that's usually on it, okay? But it's usually a yellow document with a red stop sign. That is the only thing that the EMS provider can have in their possession and say, okay, I do not have to resuscitate this person. So I'm not going to go back all the details of everything, but those are just the main things from previous lectures on this topic that I wanted to address. The last thing that I wanted to address from previous lectures was the organ donation. Okay, I have to say this again because it is very vital that everyone knows that if one person chooses to be an organ donor, you can save 8 lives. 8 lives as an organ donor. 75 people you are able to heal by donating your tissues. 2 people you can restore sight because you have 2 eyes. Even if you don't have the best eyesight in the world, they can wear corrective lenses the same way you did. That's exactly right. I'd rather have some sight than no sight. Okay? So don't even go there. Ain't nobody gonna want my eyes. I got bad vision. Guess what? A person who is blind and has been blind for years will take some vision versus having none. Trust me, I believe it, okay? What can be donated? The organs, the heart, 2 lungs, 2 kidneys, 1 liver, intestines, and the pancreas. Do the math. Let's see. 1, 2, 3, 4, 5, 6, 7, 8. That's 8 organs right there. Okay? That is how we save 8 lives. And the tissues, the corneas, the tendons, the valves in the heart, the veins, okay? The skin and the bones. Yes, the bones. Yes. Okay? Donating a bone can be for a person to prevent them from needing an amputation. Bone transplant, yes. Remove the bone that is whatever and put in the cadaver bone and restore blood. Oh my gosh. Anyway, God is good. The science that he has given man. Now, let's get back to tonight's lecture. We're going to focus on shared decision making. And I'm going to read this statement to you again. And this is actually from the first lecture, okay? Number 1, you need to know, and a lot of people think that because they're not a nurse, they're not this, they're not that, I have no medical experience, that I cannot participate in making decisions from these medical decisions. Yes, you can. You do not need a medical background to make good choices about medical care. And I'm going to tell you the main things that you need to think about in making medical decisions. Okay? Your provider is the one who brings to the table the professional guidance, the knowledge of this, that, and the other. And they actually support the choices that you make. They help guide you, okay? And you work together. So first of all, I'm just going to tell, look, there's a lot of providers out there. If you are in a situation and you really don't trust your provider, what in the world are you doing with them? Now, are you telling me that that's the only provider? Now, because let me say this. Okay, let me stop. I have lived in a rural area where there wasn't much to choose from. Yes, I have. And I'm going to tell you, I understand when you are in a situation where you feel bound in a sense. But guess what COVID did? Guess where we are today? Guess what technological advancements have done? First of all, God allowed man to, the technological advancements that we have with the internet and everything, okay? COVID came along and forced people who did not, buy into the telehealth thing to buy into telehealth. So there is a lot of access, more access than there used to be. When I went to grad school to be a nurse practitioner, I was the only person in my class that did not have high-speed internet. The only one. Because because I was living in a rural area. They had to increase the length of time to take the exam for me and my internet. I had dial up, okay? And the year that I graduated, how dare them come and put high-speed internet on the road that I lived on the year I graduated. I said, God, oh, it's awesome. I remember my internet getting cut off while I was in the middle taking an exam because I was so busy, I forgot to pay the bill. But God is such a keeper that he did not let me lose connection. I finished the exam and my internet went out. I had paid the bill and they restored it. I'm just telling you, okay? So, we have no excuses today to have a provider that we do not trust. Now, I'm not saying, we trust people and then we trust people but you know what I'm talking about, okay? So you got to trust them to guide you in the right direction. And that comes from having a good relationship with them. We talked about informed consent, all of that good stuff, okay? And when you sign consent, you need to know what you're signing. You need to be well informed. Okay, so now that takes me to where I want to start tonight in moving forward. First of all, I want to talk about a subject called health literacy. And I love my mama dearly, okay? And I don't think she'll mind me saying this. My mother is well educated, okay? She had a bachelor's degree in education, and she had a master's degree in library science. But guess what? She was health illiterate. There were so many things but thank God she had a good doctor that she trusted. She did. Thank you, Lord. Thank you, Lord. Okay? That was a blessing. But as far as knowing exactly, like details about what you're taking, why you're taking it, all that kind of stuff, nope. If her doctor didn't do it or didn't tell her, she didn't know. And it's a lot. Listen, I'm not knocking her, because if you knew how many people do not know, are lacking in the topic of health literacy or do not know things, even navigating through the hospital system, how to get things done. If there wasn't the social worker that comes in your room and tells you, well, this is what we're going to do. This is how you get your equipment. The home health would do this. Listen, there's still things today as health care evolves that I have to stay very mindful of to not be illiterate myself. And I'm a healthcare provider. You have to stay on top of these things. But I need you to know that before you can make well-informed decisions, right? You have to have some health literacy. You have to know where to get resources so that you'll know where to find this information. So health literacy is now a field that has evolved over several decades. Its initial focus was on individuals who had poor literacy skills. But they realized that, it's beyond that. Because the poor literacy skills they were thinking was just reading and writing and da-da-da-da-da. Those were the people they focused on. People that that didn't finish high school or could not write well or articulate the way things were written. No, they realized that you could have a postmaster's doctorate degree and so and still be health illiterate. So now there is a broad recognition that everyone, not just those with limited literacy, faces challenges in understanding health information and navigating the healthcare system. Okay? It can be overly complex. And I mean, it's just not an easy thing, like I said. So there was a Healthy People 2030 initiative that came out, okay, that established national objectives for health improvement. I mean, major. Healthy People 2030 also adopted 2 definitions that together constitute health literacy. And I wanted to definitely share those with you. There is a personal health literacy, which is the degree to which you yourself have the ability to find, understand, and use information and services to inform to make well-informed health-related decisions for yourself and others. And that is actually what we have been talking about in regards to in a broad perspective, that you have to be well informed yourself, make decisions, write them out, make an advance directive, share that information with other people, okay? And have someone that can speak for you when you can't speak for yourself, okay? Then there's the organizational health literacy. Literacy is the degree to which organizations equitably enable individuals to find, understand, and use the information. So the hospital has a duty and an incentive. Anytime you receive government funding, okay? There's any type of government funding, the government says, look, this is an initiative. This is something that we agree to, that you have to do too. Okay. So I just wanted to make sure you understood that. Now, I also, oh gosh, my next. I think I tried to put all these together. Okay. This is just taking that information that I just read to you and I made it a little bit bigger, okay, with the Healthy People 2030. Here is, I tried to do really good with color coordinating so I would get my slide. I did a little something to help myself. All right, so I wanted you to understand this here. Now, the provider, there is a training for them. It is called the SHARE approach. It is a flexible training program for shared decision making. I wanted you to know that it's not just you learning how or what is necessary to make the right decisions. The SHARE approach is a program developed by the Agency for Healthcare Research and Quality to help healthcare professionals work with patients to make the best possible healthcare decisions. So there's training that they themselves should go through, okay? And it starts out for seek your patient's participation. They have the obligation to make sure you participate. Now, how much your participation is, there's a little whatever there. Help your patient explore and compare treatment options. Assess your patient's values and preferences. And we're going to really get into that, okay? And reach a decision with your patient. Evaluate your patient's decision. So it's an ongoing thing, right? We evaluate, reevaluate. That's a given. Every year, these things should be addressed and reevaluated, right? These are government mandated things when you especially are receiving healthcare government dollars, right? And we know the government is the driver of your health insurance coverage as well. They're all linked together. All right. So I just wanted you to know that part of these informed decision makers. All right. Now, I'm trying to remember which one comes first. Let's do this one. Yep. Here we go. Shared decision making is a collaborative process where you and your healthcare provider work together to choose a treatment based on the clinical evidence and your personal values. These things have to line up. Sometimes if you don't know no better now, the doctor will tell you, well, this is what the evidence shows, that based on this is what I recommend you do, blah, 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 blah. I am not going to tell you, if you did not already or rehearse in your mind your personal values, it may not be entered into the equation. Hear me well. Many times, and I'm telling you from experience, that person's personal values are not taken into consideration as it should be in making decisions, but they should. It is highly recommended for preference-sensitive conditions where there is more than one valid medical option, each with different risks and benefits. Okay? So, let's talk about risks and benefits. Okay? Wait a minute. Did I get the right slide? Whoa. Best option. Yeah. This is it. Now, and then I'm going to tell you why this matters. So, there are medical decisions that we make that you have to look at the best option for you. And these are some major things, okay? Whenever the best option depends heavily on how you weigh potential side effects against your quality of life. Now, you know what? Let me stop right there and let's come back to that, because let me shift and let's talk about quality of life. I got to do that. Let's do that first. Got to. Because we're going to put this into the equation. We're going to go back to the decision makings. Number one, if you've never taken utilize a screening tool, I suggest you do in regards to quality of life. Because a lot of people don't think about, until you're forced to really think about how things impact your quality of life. The decisions that you make, you got to take this into consideration first. There quality of life scales. There are scales for, believe it or not, I was shocked to know that there's scales for animals, for dogs. There are, okay? But the quality of life scales for humans these are standardized surveys, which means they're uniform throughout. They're designed to measure a person's overall well-being, including physical health. Now, it's important to get this first. It's to know a person. You gotta get this. If you're in a situation to make decisions for someone else, you gotta know what's important to them as far as what they considered quality of life. Okay? Physical health, psychological state, their independence, social relationships, and environment. There are some people like me, myself. If I'm in a place where I can't talk to nobody, I'm gonna be pitiful. I need to be able to talk to people. Okay? These tools will help track life satisfaction, assess the impact of medical treatments, and guide therapeutic interventions. And there are 3 widely used scales that validate quality of life. And I'm gonna go through each one of them. And then we're gonna go back to the shared decision making. Because believe me, it's all going to tie together. Okay? Now, this one is developed by the World Health Organization, right? That's the one that came up with the People 2030 regarding health literacy, the World Health Organization. The BREF is a 26-item self-report questionnaire. It assesses the self-perceived quality of life across 4 core domains. So it's where, you go down and you rate this. How do you feel about this? How's that? And I'm not going to go through them because it would take too long, but I need you to know that there are 3 that's widely accepted. And pause break right quick. If you are caring for a loved one, okay, while they are still able to answer these questions clearly, please get them to do one of these scales. Because you will have it as a reference later when you are in a situation and you're trying to make a decision and the family don't agree. So-and-so don't want, so-and-so did, but everybody is trying to, what's best for mama? What's best for daddy? What's best for auntie? What's best for uncle? What's best for? But when they were able to assist you, get them to help them do it, as far as reading it to them and whatever, and getting them to tell you. So their physical health, energy, fatigue, pain, sleep, how important are these things to them? Mobility and capacity to work. There are some people, if they can't work, they'd rather be dead. There are some people who, pain. There are some people who not being able to walk. Some people, I'm just telling you, the physicality. Then there's the psychological health, positive feelings, self-esteem, body image, and sense of meaning, okay? I remember taking care of this lady one time, and her daughter, I remember, she made sure her mama hair was combed and her lipstick was on before any visitor came in her room. Because she knew how her mother was about her image. She knew that nobody saw mama without her wig on now. It is what it is. But you gotta know, you'll break their spirit if they knew that somebody saw them without their wig and their lipstick, okay? But if you never took this questionnaire and did the scale, you would never know. Social relationships, personal relationships, sexual life, and social support, okay? Environment, financial resources, physical safety, their home conditions, and access to health care. These are all part of quality of life and this particular 26-item questionnaire. Now, here is another one. Well, no. This is not another one. I'm sorry. I don't know if I got all 3 of them. Wait a minute. Let's see. This is actually telling you about how quality of life scales developed. and I just threw, wait a minute, I take that back. This is a scale. I apologize. This is called the quality of life scale, period. And it was originally created by American psychologist John Flanagan in the 1970s. I'm sorry. This scale in particular measures satisfaction across multiple life domains, such as material well-being, personal development, and community civic activities. It is frequently utilized to study the impact of chronic illnesses. I don't think this one is this was like one of the first ones. It's not as detailed as the one I just went through. And then here, this is one that I chose. This is the third one that I chose to give you examples for the survey, what it entails. But the SF-36, short form health survey. This is a highly popular clinical study that strictly measures health-related quality of life. Now, this is the one that I want to do and share with my family, okay? It evaluates physical functioning, bodily pain, vitality, social functioning, and mental health to generate composite scores representing overall physical, emotional health. And here are some details. This is what it actually measures. So this, to me, if I personally would recommend one, the SF-36 would be the one that I just actually am going to do myself. It's 36 questions. And they are divided into 8 core health concepts. Physical functioning. And this is really specific, right? Limitations. When you're limited in physical, your ability to walk and lift things. And this is very, very, very specific. And like I said, it's definitely the one that I want to do. The role that we play in these things, limitation in daily roles that pertain to our physical health. So it's really specific, okay? These are just the categories. Roles for emotional limitations, the limitations in daily roles due to emotional problems. The things that you do daily that if you're not emotionally, if you're, having a whatever, can you do, and your limitations, how you feel about that, okay? Not being able to do these things. These are quality of life questionnaires now. Social functioning, limitations in normal social activities due to physical, emotional issues, like being able to go to church. Being able to leave, go sit on the back porch, get out on the front porch and swing in a swing and inhale the fresh air, And if you're like me and you got allergies, I just got to put on a mask. That's all. But I love the sunshine. That's how we get the melatonin that we need so that we can sleep at night. You have to go outside and get daylight so that melatonin will allow you to sleep. Why do you think people take melatonin tablets at bedtime? Because they're not able to get outside in the sun and get natural melatonin. Okay? So you open up your blinds in your home and you let the sun shine in. Yes, that is helpful. When people say, well, I can't sleep. I've got insomnia. What do you recommend I take? I say, well, I recommend, back in the day, I'd say, well, you could take a sleeping pill or take some Tylenol to help you, whatever. But today, knowing what I know today, I say, sit outside in the sunshine if it's not raining, or open up. If it is raining, many times the sun still shines, right? Through the clouds or whatever, and you sit in the window. Why you think cats sit in the windowsill? Okay, dogs, the door's open, so the dog is sitting in the door. They ain't crazy, okay? I told you there's quality of life scales for animals. All right, then we have our bodily pain. severity and impact of pain. Okay? Vitality, levels of energy, and feelings of fatigue. Now, I'm not going to get into it, but pain is so up there with mental illness. Chronic pain is a factor in our mental health. When a person has chronic pain, people forget there's so much involved in treating chronic pain. Vitality, your level of energy and feelings of fatigue. Some of it, believe it or not, is medication induced. The time of the day you take certain medicines. You have to consistently take something, and you have to sometimes, you tell your doctor, well, I take my medicines in the morning, and then by 2 hours later, I can't function. Well, look, tell your doctor, tell your pharmacist, and let them figure out, because there are certain medications that have side effects. Number one. Now, there are certain medications individually that may not have that side effect, but collectively, if you take them together, they may synergistically create a side effect. See? Okay? So, mental health, the psychological distress and well-being. Now, we all go through stress daily, okay? It's a given. We live. We go through stress daily. But it should not be every single day. And if it is, there are depression scales that we do. And we try to figure out what makes... Let me just say this. I always try to be transparent about myself. I work from home. 3 days of working back to back. Oh, shoot. I got to get out, got to get out the house. And I'm usually road runner the whole day. I got to. If I did not, I would be probably headed toward a depressive state. Okay? Misery loves company. All right. General health, overall evaluation of your personal health. How do you feel? Your doctor ever asked you that? How you feel about yourself? How do you feel? Blah, blah, blah. How do you see yourself? How do you whatever? Why do you think they ask those questions, okay? But this SF36 quality of life scale, if you can't do 30, anyway, I recommend it, okay? And I'm going to do it myself. And it tells you at the bottom about scoring and how this is used. The responses are aggregated and scored to give clinicians and researchers an objective look. Not what you say, but objective, what they see at your physical and mental dimensions of health. While the SF36 is often self-administered. You take it yourself, but an official scoring algorithm is typically required to interpret the results properly. Okay? All right. Now, we've covered that. I want to go back now talking about risk and benefits of things. So first you got to know you yourself and the quality of life you desire. So when you're forced with making a decision, then you say the risk versus the benefit. If the risk outweighs the benefit, don't do it. If the benefit outweighs the risk, do it. Simple as that. But you got to understand and be well informed, okay? So in medicine, risk versus benefit is the constant calculus. That says constant. Constant now. It ain't going to stop. You're going to have to keep weighing this thing out. It's like the pendulum that swings, okay? It's a constant calculus of weighing a treatment's potential positive outcomes against its potential harms or adverse side effects. without the expectation of a significant benefit. Patients and physicians are unlikely to accept even a small amount of risk. There has to be a significant benefit in you having that procedure. And I'm going to tell you now, so many times you perceive something as fixing. Okay, let me do this for example. Knee replacement, hip replacement, shoulder surgery, right? A lot of times you have to weigh the risk versus the benefit. Now, if you only have pain when you cross your leg, just don't cross your leg. If you have pain every day, all day, in everything you do, then the benefit of getting the joint replacement may be greater than the risk. Because a lot of people think that if you have a joint replaced, you will never have pain again in that joint. And that is not so. It's not so. Okay? I'm going to stop there on that one. But that's just an example of one thing. Okay? There is also pain that you can get from adhesions from a surgical incision. You can have your hernia repaired. And every now and then you may get a little discomfort there. But some of it is not doing what the doctor told you to do post-op too. If you don't treat the incision and if you overuse the muscles while they're healing, you can create adhesions at the incision site. You can create hypertrophy tissue. We unknowingly, if we don't do what we're supposed to do, can cause post-op pain and discomfort too. And then I've had people say, I shouldn't have never had that surgery. Well, were you well informed? The risk versus the benefit also includes your ability to adhere to post-op care. Because if you do not follow post-op care and treatment, you could end up with an abscess and end up with, I'm telling you now, and then the abscess itself caused tissue damage, and you end up with having to have another surgical procedure to treat the infection, the abscess, remove the cyst or whatever. And then you're like, you got this chronic issue that you didn't maybe have before, because guess what? Nerve pain is nerve pain. I'm going to tell you, okay? You let people who have had amputations tell you about phantom limb pain, okay? And sometimes we'll say, well, just cut it off, whatever. The infected toe or the infected hind foot. Well, can I walk without it? Yeah, we'll go on and cut it off. And then you turn around and have nerve pain. I'm just telling you, you got to really, really, really be well informed, okay? So, medical experts and regulatory agencies such as the FDA, Food and Drug Administration, they analyze and communicate these trade-offs from a structured framework. And so a lot of them will tell you, like medications, they'll tell you if you take this medicine, blah, blah, blah. And many times, remember what I've said to you in the past about reading the literature, the fine print, okay? Breaking down the trade-off, benefits. If it's a benefit, the helpful clinical important effects expected from an intervention, such as curing an infection. Well, that's a benefit, because infection, if it gets in your bloodstream, you get septic and you die. Okay? Lowering your blood pressure. Well, if you don't lower your blood pressure, you could have a stroke, a heart attack, and die. Or relieving chronic pain. Chronic pain, some people can deal with it, just depends on the intensity, depends on if there's things that you can do, therapy, physical therapy, different things to alleviate some of that pain, okay? Risk, unfavorable or toxic effects, which can range from minor discomforts like nausea, mild headache, to serious unexpected events like liver damage, bleeding, or organ damage, okay? Taking certain drugs can affect your liver, but it's a cancer that you're trying to cure, right? The bone marrow suppression that you end up with after chemo. But thank God they have drugs now that help prevent that. I'm just telling you. Thank God for technology, but risk versus benefit and things. Make sure when you listen to other people, you listen to them, their age group, and when they had their procedure done. Because I will say this, don't let someone shy you out of having something because they had it 30 years ago. Technology, look, back in the day, gallbladder surgery, oh my God, they would split you down your abdomen, okay? Today, it's laparoscopic procedure. Bloop, 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 bam, gallbladder out. You're home the same day, okay? The assessment, the balance is highly subjective. And it depends entirely on the severity of the disease and the availability of alternative therapies. A highly toxic chemotherapy drug, isn't that what I was just saying? For instance, has massive risk. But they are entirely justified if the benefit is a potentially curative cancer treatment. Okay? Now remember what I always said. Pray, 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 pray. Anoint your medication and pray. Listen to the voice of God. Father, I need you. I can't live without you. That is inclusive in making the right decisions. Now, the last thing, I think I covered everything. Let me see. Did I do this here? Yep. I did that. I did. Whoop. I think I did pretty good. I cannot believe it. Not me. Okay, here's the last thing I want to show you. And I know it's kind of small, but I hope you can, if you got a smartphone, make it bigger. And the only reason I put this up here is because I want you to also know, just like I said about the share approach, that providers are encouraged to utilize in assisting you to make decisions. I want you to see and know that, look at this chart here. In order for a doctor to get paid for the treatment that they give, do you see where it says elements of medical decision making? They have to scrutinize what they do as well, or they're not going to get paid. So there, you see the codes on the side, and then at the on the left, right? They got these codes here. If they code you as a 99205, which is a high level of decision making, okay? They have to meet all of this criteria. So if, depending on what decisions are being made for you, like helping you make a decision about whether or not to do cancer therapy or this, look at all the things they have to do too. And the only reason I put this up here was because I wanted to show you the complexity of what they themselves have to go through in the process of helping you make decisions. It's not 100%, oh, well, this is what they think. No. Did they offer you this? Did they do this? It has to be an extensive blah, 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 blah. And they had to go through a high risk or morbidity from additional diagnostic testing or treatment. These are things in a medical decision making. Okay? So their medical decision making ties in with your shared decision making. Okay? And the two shall meet and join and become one. Okay? I just need you to know and understand the other side of the fence and understand what's available to you. And if you don't have knowledge of these things, you're not well informed. And where you thought you made the right decision, you may find out later, I did not. I do not want you to be a woulda, coulda, shoulda. I should have listened. I should have read more. I should have this. I should have asked. I should have requested a second opinion. The more people you talk to, but you got to talk to people with an open mind. And guess what? Keep in mind your quality of life that you desire for yourself. So I recommend you start in any aspect of this lecture, these 3 lectures that we did. Start by determining where you are in your quality of life. And I didn't even use my little outline I made. Nope, that ain't the right one. I'm sorry. Here we go. Oops, let me get rid of that one. I did have an outline. Well. Once you make a decision and you sign a consent, the decision is made. And guess what? Why do you think on your, especially an informed decision, right, for surgery and things such as that, they'll have on there a lot of stuff on there that says, well, in the event that we find this, you're giving us permission to do this. Or in the event that, because you cannot give consent after you've been anesthetized and put to sleep. Once you had anesthesia, it's too late. It's too late. Okay? Now, if there's a complication, unexpected, because of the fact that you have an advance directive and you have a health surrogate, you have a spouse who is your automatic health surrogate when you can't answer, because they're your spouse. No spouse, here go your children, okay? You got 3 kids. 2 have to decide, okay? But we don't want to put that stress and strain on our loved ones. No, don't put them through that. If something happened and the decision they made did not have a positive outcome, we don't want guilt. We don't want them living with guilt. And we don't want their siblings blaming them. If you hadn't done that, mama wouldn't have died. If you hadn't done that, daddy wouldn't have died. You did this and you did that. Do not let the devil tear your family apart. While you are alive and well and in your right mind, put it on paper. The living will that we talked about. People put their finances in order, right? They'll say, well, a beneficiary, okay? In the event that I die, I've got this divided up 25, 25, 25, 25 equals 100%. Okay? I mean, I have 3 children and I have a husband. So I made sure I've got provisions for my husband, and then I got provisions for my children. Yes, that's what you're supposed to do. I don't want none of that bickering, none of that. But I do admit, my advance directive and the living will and my quality of life and all that stuff, I'm going to actually sit down and do it. I probably need to go and print it out now, so while I'm watching TV tonight, maybe I can do it. I don't know. I have so many things to do that sometimes I get whatever. But this is an example of the Living Will Declaration. Please go on and get it done. And we talked also last week about life insurance. And I'm going to say it again. Please have at least a term policy, $10,000, $5,000, something. Please do it. I sacrificed my nails to make sure I can be buried. I'm just telling you, it sounds morbid. But guess what? It's the truth. That ain't the reason why I quit doing my nails. I just was tired of it. Look, I'm tired of giving my money to people who really don't care about me. And they'll lie to you to get you to, ooh, this is so pretty. Ooh, yeah, right. Yep. Look, it is what it is. Those days are over with for me. The things of God that is going to make a difference in the lives of other people, the things that God has allowed me to do is what I'm concerned with right now. Yeah, I'm enjoying life. Pastor Devlin and I, we're going to travel and see the world. You know why I want to? Let me tell you my reason for wanting to travel and see the world. My reason for wanting to travel and see the world is because I want to marvel at the things that God made. The Niagara Falls. The things that the Lord did when he created the heaven and the earth. I want to see them. I flew over the Grand Canyon. Oh, it was so beautiful. I would never forget that birthday. That was on my bucket list of things to do. But there's so many things I do want to see. The geysers, the iceberg, different things, right? I do want to see those things. Yeah. So I even want to go, that mountain where God spoke to Moses. If they let you go there, I want to go there. The tomb where Jesus was buried, I want to go there. That's what I want to see. That's the reason I want to travel. But it ain't just I want the things so I can see, Lord. All right. God bless each and every one. Thank you for joining me. I am Dr. Anna Shaw Devlin. We are completing our 3-part series on being well informed, making the right decisions, but understand what should go into you making the right decisions. Take the time. And even though we know people and we've known them our whole lives, I bet you there's some things on that questionnaire that we never thought they would answer that way. Take the time and do it. Okay. All right. To God be the glory. God bless you. Pastor Devlin will be, I don't know. It's holiday weekend. I don't know. I don't know what he may do. He'll surprise you. All right. So I don't know about Sunday, but I do have to work. So, but God bless you. We love you. I pray that you have a restful night's sleep. I pray that something that I have said tonight will be a blessing to you, if not to you individually, be a blessing to your family. Okay. All right. Have a restful night's sleep. Adios, amigos.